Okay, I'm going to go ahead and get us started. So my name is Kelsey Mora. I am the Chief Clinical Officer at Pickles Group, and this is our clinician webinar. We actually have three clinician webinars, but this is our original webinar. So this was, I'm going to pop back to that slide in a second. So this session is the first in our three-part series. So just for you to have the background, this session was really born out of a need that we saw with many clinicians attending our How to Talk to Kids About Cancer webinar, which was originally designed for parents. So I did see that there are some parents registered. That is totally fine. You are in the right place. Everything that I talk about today will still be helpful for your families. But we designed this training to be a little bit more clinician facing in terms of those who are speaking directly with adult oncology patients to make sure that families are feeling better supported across their experience. So the What About the Kids is really those foundational skills and topics about how to support parenting patients. And then we developed the How to Prepare the Kids. So that's our second clinician webinar offering. And that one focuses on more advanced care conversations. So that includes end of life conversations. And then most recently, we offered our new clinician how to, which talks about how to apply these foundational skills in real time at the bedside. So it comes with a double-sided how to guide. And that's a really helpful tool for how to make some of this actionable. If you are a social worker, we get this question a lot. You will not receive CEs for this specific talk, but I just wanted to make sure you know that there are some ways to do that. If you are a member of AOSW, we have presented twice with them, and so you should be able to receive that social work credit from their archive. And then if you are not a member, I think you can pay to watch it and receive that. And then we also did a podcast interview with ONS. So for any nurses on the call, I believe you can still get credit for that as well. We do provide a certificate of attendance for anyone who requests it. So that is something that you can use for your own record keeping, or if you are work in a profession where you can use that for your credentials. And last but not least, all of these webinars are available on our YouTube channel, as well as if you are a part of our Parenting Patient Champion program, which I saw a lot of people in the chat that are part of that program. So thank you for being our trusted and official partners. We offer tailored webinars. So that is one of the offerings as part of being a Parenting Patient Champion program. I just did one this morning. And essentially, that's being able to select one of the three webinars available and having a closed webinar for your team of healthcare professionals. So something to keep in mind if you're interested in joining our Parenting Patients Champion program, which I'll share more information later on in this call. I did see, I'll go back one slide, but I saw a lot of people are sharing in the chat where you're joining from. So thank you so much for doing that. That's super helpful. I see a variety of different roles and settings. So thank you. I see we've got some nurses, some social workers, some child life specialists, program managers, chaplains. So just appreciate seeing where you're all joining from and helps me tailor the conversation to be most helpful. Like I said, throughout the conversation, the chat is open as well as the Q&A, and my colleague Miriam is on the webinar. So if you do have questions throughout, you're welcome to use either of those features, and we will get to them either throughout the webinar or certainly at the end. Also, when you registered for the webinar, there were a lot of submitted questions, and so I've included those later in the presentation to make sure that I'm addressing all of your questions. So a little bit more about me and my background, just so you understand kind of where I'm coming at from this work. So I am a certified child life specialist and therapist. So I was a former hospital-based child life specialist, specifically working in the pediatric ICU, but I worked in a children's hospital within an adult hospital. So what that meant is that we were often getting called to the adult side to help with children who were at the bedside visiting a loved one or parents who were asking, how do I support my child? Although we were dedicated to the pediatric hospital. So I really saw it as a gap in service and care because many of these families we'd be able to get some resources to them, spend a short time with them, but we really weren't able to get to every family and we weren't able to do the extensive amount of support needed for these children. I went back to school and got my counseling degree, and I've been in private practice for many years. in addition to my work at the hospital. And through that work, really helped found Pickles Group with our initial founding families who were looking for community support. Their kids wanted to meet other kids who had a parent with cancer. And so about 5 years ago, I left the hospital setting to take on this role and really think about how to scale and expand our resources to make them available to more kids and families. I'm also the author and creator of the Method workbooks, and that includes the DOT method, which is an interactive tool to teach kids about cancer. And that is something that we also use in our curriculum to help our kids who are going through the Connect Over Cancer program. In addition to all of hopefully the great support that we can discuss today, I also just want to mention that our next Connect Over Cancer cohort for the summer is starting in July, and the registration deadline is June 27th. So I'm going to say that multiple times. If you are thinking of families that you work with who could benefit from that peer support, please do me a favor before this call ends or right after this call ends, refer those families. And there's a really short referral form on our website. What that does is it gets them into our contact system, and then we can follow up via phone, text, email, and really help get them in the right place and make sure their kids have access to the right programming this summer. Summer is a time when a lot of support kind of falls off. The kids aren't going to school every day. They're not seeing their peers, their friends, their classmates every day. And so we really want to make sure we're having that available for kids where the summer is a time where they could use more peer support and social emotional support in general. So please refer your families. My colleague is putting the referral form in the chat right now, so you can open that and save it and refer as many families as are on your mind. And again, that youth programming is for first through 12th grade, so kind of around the 6 through 18 age range, and the kids are split into age-based groups. But again, I will get into that in more detail at the end of the presentation, so stick around. All right, so before we get started, I want to just kind of ground us in thinking about the patient that is in front of you that needs this type of support and approach. So when you're meeting with parents and they're getting a lot thrown at them about treatment and diagnosis and surgery and insurance and scheduling and medications, they often are thinking about their kids. And so much is overwhelming, and yet it is not always the case that someone is addressing their concerns about their children. And so you are at this webinar, you are one of our parenting patient champions, you are referring families because you're saying, I see you, I get that parenting with cancer is a whole nother ballgame, and I want to make sure that we are prioritizing your children and your parenting concerns. And so what these parents are thinking is, what about my kids? That is the name of this presentation. They are getting so much thrown at them that's related to their health, but all they're worried about is the well-being of their own children and how they're going to caregive while navigating cancer. And so when they're thinking, what about my kids? We really want to address that concern. They might be wondering, how am I going to tell my kids? Maybe it's at the top of a diagnosis, or there's a change in treatment, or a new surgery, or a new medication, and they're wondering, how am I going to tell my kids about this? Because so much information is being given to them, and now they're trying to figure out, how do I digest this and translate it for my children? They may be feeling, I don't want them to be scared. I'm scared enough. The C word is scary, and I don't want my kids to be scared. How can I help support them and not make them scared? A lot of parents feel like they have to be strong for their kids. We might not know what being strong means to them, but that's something that parents are thinking about as the protector or the leader of their family is, I have to be strong and I have to hold it together. And so we're going to talk a little bit about how do we help address that need. And parents may worry, I can't let them see me upset. Parents have their own emotions, and they might feel like their child can't see those emotions or experience those emotions because it could be too scary or too upsetting. And there are a million other things that a parent might be thinking or saying, but here's some of the ones that come to mind. And I'm sure you all can relate to having heard or seen a parent who's in that position of wondering and worrying, what about my kids? So what we're going to cover is how kids understand cancer by developmental age. I saw there was a request in the registration form about wanting kind of that developmental support. We address that regularly. Our youth programming, like I said, is for first through 12th grade, but all of our education materials span the lifespan. We recognize that families have kids in various ages and stages of development, and so we want to make sure all of our resources address those needs. and recognize that kids aren't really able to engage with other kids, especially in a virtual format, until they're a little bit older and attending school and whatnot. We want you to be able to master tips to guide patients talking with their kids. So, some of you might be feeling really comfortable, and some may be feeling less comfortable. And the point is that we want to change the system. We want every parent who's going with cancer to feel like their team really knows how to support them and support them in supporting their kids. And so, hopefully, you can walk away feeling like, yep, I'm already doing this. I've got this covered, or I learned something new, and I'm hoping to apply it when I work with a parent. I want you to be able to get ready for those what about the kids questions, not even just get ready for them, but anticipate them. So I'm not covering this in this webinar, but our clinician how-to is all about the assessment, actually asking the right questions. Do you have kids in your life? Do you have kids in the home? Because if we don't ask, parents may not offer that information and it might be weighing them down. And so being really prepared for the what about the kids questions and capturing those parents that are sitting there worried and wondering about their children, but nobody has maybe asked. We want this group of people to be the ones asking about kids, and then identify how and when to use resources. So I think many of you are probably aware, but if you're not or you're new, this is your first webinar, your first time interacting with Pickles Group, I just want to reiterate our mission and our three pillars. So we provide free peer-to-peer support and resources for kids and teens impacted by their parent or guardian's cancer. We do that in three main ways. So this is from an article from 2017. There's a need for a lot more research in the field, which we're hoping to contribute to in the coming years. But right now, these three pillars are really what kids need to thrive with their parents' cancer. And that's been part of my training, my professional experience, and something that we really infuse into everything we do at Pickles Group. So we believe and we provide honest and age-appropriate information for kids. We want to empower kids to utilize their coping skills. Many are existing coping skills, and some might be new. And then peer connection. So that is a big piece of Pickles Group is bringing these kids together to know that they're not alone and that there's other kids who have a parent with cancer. When it comes to the coping skills and the communication, those are life skills. So regardless of the fact that a kid is facing a parent's cancer, our hope is that they can use and activate these skills through many aspects of life. So I'm going to start by just showing what is referred to as the four C's. So this comes out of some literature from Canada. And the picture you see on the screen is actually our very first original Pickles group. So these were the founding families. I was in the gym in person with them. I was being the facilitator, and I gave them the space to write down anonymous questions about their parents' cancer. This has now evolved into what we call Phone a Pickles Friend, which is something that we make part of all of our groups. So kids have a chance to submit anonymous questions about their parents' cancer, and we get so many questions every single week and month. And so you can see on the screen, just because we're not talking about it doesn't mean kids aren't carrying these thoughts and worries. You can see things like, will brain cancer make you forget your memories? What makes the cancer cells multiply quicker than normal cells? What is a port? How did this happen? What is the percentage of people who get cancer? If a medication doesn't work, will there be backup? And so kids are carrying really heavy, big questions. And what we do is provide honest, age-appropriate responses to the community, to our community of parents and kids. But some of the common ones, and these are going to vary a little bit by age, but is kids asking, can I catch it? So a lot of times kids may not understand that cancer is a different kind of sickness. We often talk about it as a problem with the cells. It's not caused by a germ or a bacteria. And so that's a really concrete way to help kids understand that this is different, because when they think of sick or illness, they're often thinking about a germ, and that's not how cancer works. And so for the youngest kiddos, and I'm going to talk about this shortly with developmental responses, they really need to understand fundamentally how cancer works and how it's different. Kids might also wonder, like, did I cause it? And that can sometimes surprise people if you're not involved as much in child development. This comes from that magical thinking of, did I do something to cause this? I was naughty yesterday, or I didn't listen, or I saw my parent eating, chocolate, and I heard chocolate's bad for you. Did that cause their cancer? They're trying to make sense of it, and they're trying to make sense of it with the information that they have. And so they may worry about those things. They also want to, just like parents want to protect and fix things for their kids, kids will sometimes do the same. And so they might ask, can I cure it? How do I make it better? How do I make it go away? They might even want to tap into some heroic measures, maybe something they saw on YouTube or read in a book. And, especially kids who are thinking about superheroes and more fantasy land, they're really grappling with how do I make this better? Are we doing enough? And then last but not least, kids may wonder or worry, who will take care of me? And that could mean who will take care of me if you die, but it might mean who will take care of me if you're not feeling well or if you're in the hospital. And so helping empower parents to give their kids some of that information. Who's in your support system? What will change? What will be the same? Those are all things that we're going to talk about because kids are already wondering. And it's very common for kids to approach things from more of like what I would call an egocentric view. So kind of their own lived experience of what's this mean for me? How is this going to affect me? So we'll talk about developmental responses. So like I said, I'm going to cover infancy through adolescence, but our programming is really designed for that elementary age and adolescent group. So first through 12th grade, kids are in age-based groups or development-based groups. So we do have kids, teenagers that are together, which is teenagers, and then younger kids and middle kids. But for infants and toddlers, this is the age group that people often think, they're too young to understand or they'll never remember. There is some truth to that. Obviously, they have limited understanding, but that doesn't mean that they don't sense the changes and aren't aware of like the feelings and the behaviors around them. So when we think about a young infant who is crying and dysregulated and they calm down by their parents' breath or physical movement or skin to skin or all of those things at a young early age, there's science behind that. It helps regulate a child. And so if the environment is feeling really chaotic or different, or it's causing disruption to a little one's routine and feeding regimen and sleep regimen and childcare and nurturing, they're gonna feel that and they're gonna show it in their own ways that they're capable of. So that could be, crying, could be irritability, it could be difficulty sleeping or eating. Toddlers may not understand like why my mom can't hold me because she had a big surgery, and so helping them understand that it's not their fault, that there's a reason. Sometimes for this age group it might be as simple as like drawing a body outline and showing them there's soreness, there's owies, there's boo-boos on the chest, and showing them that that makes it hard to move their arms, and so mommy can't hold you for a little bit, but it's not because mommy doesn't love you, and here's some other ways that mommy can support you. So really helping little ones kind of understand the ways that their life is being impacted. And for preschoolers, this they start to have some understanding, but they're often relating it to what's familiar to them. So this is that age group that I was talking about with, what does cancer mean and what does sick mean and is it a germ and can I catch it and did I cause it? And so they really actually need more information because they're trying to relate it to what's familiar to them, and often they get it wrong just because they don't know what it means. As adults, we're often more scared by the big bad C word. And for kids, it's like it helps actually name what it is and clarify for them. And some families are not comfortable using the word cancer, and that's okay. We could talk about it as a problem with the cells and make sure that kids understand that it's not a germ and you can't catch it and things like that. And then in elementary age, this is a group that we see a lot of at Pickles Group. They definitely have increased understanding, but they might have misinformation. So they might be getting their information from their friends or from Google. And so we want to help make sure they're getting information from their most trusted source, which is usually a parent or a caregiver, but it also might be guiding them with appropriate resources. So books or websites that are appropriate. Pickles Group, we provide honest and age appropriate information that's helpful for kids. And so them being able to support each other, but in a way that is accurate and helpful. And then teenagers are kind of another forgotten group because we think they understand more than maybe they do. They might still not fully understand things, or they might be thinking about really big picture stuff like, how does this affect me? I want to be helpful, I'm capable, but I also have my own life. Like, how do those things intersect? Um, they might be thinking a lot about, we get a lot of questions about genetics and am I going to get cancer? Is someone else going to get cancer? They're trying to understand, how this affects everybody in the family and what they can do to be helpful, but also to preserve their own childhood and adolescence. And so we see a lot of needs for teens. And we now have a really robust and growing peer leadership program. So we have kids who are older in the program who are now serving in a peer leader role where they're helping the newer and younger kids. So I think some of you have had a chance to hear from some of those peer leaders in multiple capacities. We're going to continue to be growing that program and really making sure that that parents and clinicians are hearing directly from the kids because that is so much more impactful than hearing it from me. We just had an email went out from one of our graduating seniors, Francesca, who's one of our founding youth, sharing her own experience and perspective and talking about why it's so helpful to be honest with your kids. And so that those are helpful ways for us to really share that messaging because they're living and breathing it every day. So I'm going to give a closer look at the Family Cancer Support Kit. Hopefully you all know what that is by now. It's been around for a few years, but we have a free Family Cancer Support Kit. So this is a guide that can be mailed digitally or in print anywhere in the world. We send it to families, but we also send it to hospitals. So the purpose of this is a clinician webinar. If you work at a hospital, a clinic, you can request this for free. We will send it to you in packets of 25, 50 in Spanish or English or both. And it is a great resource when a parent is asking, what about the kids? For you to say, we have a partner, a Pickles Group. It's a free nonprofit. Here's a resource that has information in it about how to talk to your kids about cancer. We break it down by age. We have common terminology, child-friendly definitions, a family activity, common questions that kids ask. And it's that great first step for getting involved with our organization. We're really excited because this year we're also going to be launching a new, or I should say, an additional kit. It's not replacing this one. It's actually going to be how to talk to kids about advanced cancer. So it goes along with some of those questions more about end of life or advanced care planning and how to talk to kids about things like hospice and dying and things like that, which is unfortunately a question and a need that we get a lot, and we hope it will help your families as well. So stay tuned for that resource. If you're part of our Parenting Patients Champion program, you may have also been invited to provide feedback on that resource, which is super exciting because we can't create things alone. We're better together, and we want to hear directly from you at the bedside. So the three guiding tips for talking to kids and teens about cancer. So we've developed these three tips and we apply them to any conversation. So this is not just that initial diagnosis conversation. When the 2.0 kit comes out, you'll see that we're applying these three things also to end of life conversations. So we want to create a framework that makes it easier for everyone to approach these difficult conversations. So it starts with sharing information, and that really gets at the honest, age-appropriate information. Sharing expectations, that gets at that normalcy, what's going to change, how do we navigate the day-to-day and the changes along the way. And then sharing feelings, that's really about that coping and that emotional side of things. So I'm going to break each of these tips down in more detail. So we'll start with the sharing information. So when you have a parent who's asking you, how do I tell the kids? You might be guiding them on thinking about where, when, and who. You know, who can be with you during that conversation? Is there another parent? Is there a friend? Is there a professional? So that parents don't have to have these difficult conversations alone. Thinking about just what does your week look like? What does your environment look like? Is there kind of a neutral, supportive place to have this conversation? Ideally in like the more of the center of the home, not a kid's safe bedroom or right before bed. So thinking about even just planning that out can be helpful because parents are just so overwhelmed and they don't even know where to begin. Also, providing a warning can be really helpful. What I mean by that is helping parents say to their kids, like, hey, I have something difficult to talk about, or I have something important to tell you. And what that does is just help kids tune in a little differently, that the conversation that's coming is going to be different than what they're used to. Parents might be asking you, what do I tell the kids? Obviously, they're getting so much information and it's overwhelming, and they're thinking very far into the future. And we want to pull them back to what I would describe as an age-appropriate version of the truth. So what do kids need to know right now? And to figure out what they need to know, you might be working with a parent to think about the observable changes. So what have they seen? What have they heard? What have they witnessed? What have they experienced? An example I give a lot is, a parent who's diagnosed with a brain tumor and they have a seizure at home and are transported by ambulance, and we don't know why yet. And we're trying to just talk to that child about what happened at the home. We know that daddy had something called a seizure. We don't know why. We're going to get more testing at the hospital. He's safe right now, right? And then we can build on that conversation when we know more. they took some pictures and they found something that's not supposed to be there. It's called a tumor. It's a clump of cells. The next step is to test those cells to figure out why they're there and how to treat it, right? So we're breaking down in these small conversations, but helping a parent who is so overwhelmed and so worried think about what does your child need to know right now? Because a common question we get is, when to tell them, how much to tell them, and it can be helpful to start with, here's what we know, or here's the first step. And then that will lead to what they want to know. So some kids may have a lot of questions, a lot of concerns. Some kids will be fine with what's been shared with them. And so helping parents understand if you start with what they need to know, that opens the door, and then they can ask you if they need to or want to. They might worry, just like, what about my kids in general? Are they going to be okay? Parents worry about getting it just right or perfect or saying the right thing. The whole point of having open conversation with kids is just to build trust and open the lines of communication. And so we want parents to understand that it's not about getting it all right. It's really about helping your kids know that they can talk to you about this when they want to or need to, that it's an okay thing to talk about, that they're included because kids already know that something's going on and we want them to know that they matter, they're part of the family, and that we can talk about this. Some kids won't want to, and that's okay. We don't have to force them, but we want to just build that trust and that safety around that, and then follow their lead. If they want to talk a lot, we can. If they don't, that's okay too. And just helping parents know that really the goal is just building trust and openness, and the rest will kind of follow. And then sharing expectations is really about all those kind of changes that happen along the way. So these are not a one and done conversation. It's about starting the conversation with the need to know and then helping parents build on it. A lot of times, those subsequent conversations will feel a little bit more approachable when a foundation has been established. So we can encourage communication around big changes. So helping a parent think about when there's updates, whether that's good, bad, or otherwise. Families are often focused on everything that's going to change and everything that's going to be different. And it can be helpful that there will be some things that will be the same. You're still going to go to school, but this is who's going to pick you up, or this is how your transportation is going to change. And that helps kids know, okay, this is going to be the same and this is going to be different. It also helps them cope with the unexpected. If a parent suddenly has to go into the hospital due to a fever, we can say to them, remember how I have those cancer cells in my body and my body's more sensitive to germs. When I get a fever, I have to go to the hospital. It's different than, someone who doesn't have cancer, they get a fever and they can usually stay home and take care of their body. So you're building on what they already know versus feeling like you have to start from the beginning and a parent has to explain everything just to explain why they're in the hospital. So having that foundational language can actually help with those unexpected updates. I talk a lot about, cancer is a chronic illness. So helping kids understand there will be some planned visits and some planned medications, and there will be some unplanned visits and some changes that happen along the way. Here's what we know, here's what we expect. And then we can say, there's been a change. They tested my blood and it wasn't ready for medicine. So I have to wait another week or something like that. Ultimately, when navigating cancer, just as much as your parents you're working with feel out of control, kids feel that too. And so, one way for parents to help kids gain a sense of control is to involve them, to provide choices. Sometimes that's choices about, how involved they want to be. Do you want to come with me to my doctor's appointment? Do you want to visit? Do you want to FaceTime? Do you want to make a card? Or just everyday choices. Do you want to do your homework now or in 30 minutes? Do you want to do it before dinner or after dinner? Do you want the red bowl or the blue bowl? It sounds silly, but it helps kids know, like, I still have a choice in the matter and I can still feel a sense of stability when everything feels out of control. The parents you're working with also want to continue to parent. They want to be able to be involved in their child's life. And sometimes kids will kind of self-monitor. I don't want to talk about my homework or my friends because my mom already has enough going on, and helping them know, like, your mom wants nothing more than to help you with your homework right now because that helps her feel normal too. And so helping kids and parents kind of adjust. There might be things that are a little bit different, but also still having some normalcy around roles and responsibilities. I often tell parents, you can't control the situation, but you can control how supported your kids feel. And finding ways to do that can be really empowering for the patients you're working with. Parents are also thinking really far in the future. Kids may or may not be. They also might be thinking about really different things than a parent is thinking about. So, helping parents pull back and take things one step at a time. And in your role, I saw there's a lot of different people represented here. You might be the one doing resource navigation or helping a parent help themselves. And so, when they can do that, when they can ask for help, when they can lean on resources for themselves, that's a way to parent their child. It's taking care of them so that they can better take care of their kids. And so, that can be tremendously helpful for parents as well. And then last but not least, sharing feelings. So this is the parent that's saying, I have to be strong for my kids. And we might have a conversation about what does being strong really mean? A lot of times parents think of strong as maybe holding it all together, or not crying, or protecting my kids. And being strong can also be an opportunity to model and teach and support children through really hard things. This probably won't be the last hard thing that they have to deal with. Hopefully, it's not nearly as serious as cancer. But there are also a lot of hard things throughout cancer. And so this is about building their toolbox and building their skills to be able to better withstand and navigate challenges. And that can be really that is an opportunity for parents to have that role is like not only them navigate, it stinks that they have to navigate cancer, and this is an opportunity for them to really learn how to handle really hard things. Um, Parents may say things like, I can't let them see me upset. And in your roles, you might be actually normalizing their feelings. Like it makes sense to be upset. It's very natural to be upset. And being upset might actually give your child permission to be upset too. If kids see that all feelings are welcome and they see their trusted adults modeling natural feelings, that can give them permission and help them feel like, okay, it's okay. It's also okay to laugh and be silly and joyful and to have some, normalcy, and helping kids know that too, because kids sometimes feel, maybe guilty about playing or hanging out or having fun when their parents dealing with cancer. And so helping families also normalize the positive emotions that can still coexist with the hard parts of cancer. You also might be helping a parent identify their own coping skills and support system, which, like I said, is a way for them to support their kids. If a parent is able to say, I feel really upset right now and I need to take a walk, or I need to take a breath, or I need to call my friend, and a kid hears or sees that, it shows them how to deal with emotions, and give them the tools for the next time that they feel upset. And you can kind of have families embrace that as a family, that like coping doesn't look the same for everybody. There's a lot of ways to cope, and we can all do that together. And parents may worry. I don't want them to be scared. They may feel like if I tell them something, they're going to be scared. And we want to help them understand that sometimes kids are more scared by what they don't understand. And so explaining what's going on can actually clarify whatever story they've told themselves, because kids will try to make sense of it and they will try to understand it on their own. And when they're given honest information from an adult, they're getting accurate information, which sometimes provides a little bit of relief and actually reduces their stress, because they understand, like, okay, this is what's actually happening. I don't have to try to guess or figure this out on my own. Um, as parents want to fix things for their kids. And when it comes to cancer, unfortunately, there's nothing easy to fix here. And so helping parents really understand that their role is to support their child over providing solutions, and that can be tremendously helpful. So these three tips are really about helping share information, helping your parents know what to share, how to share it, where to begin, what the point is, really building trust and following their child's lead, sharing expectations and kind of feeling that sense of control and normalcy along the way. And then last but not least, really embracing feelings and coping as a family. And these three things together can help your parents feel more capable, but also help kids cope and thrive through a hard thing. And like I said, we've got kids to show for it. Our kids are really, despite everything that they're navigating, these tools and these resources and this guidance from their trusted adults is really helping them live their life and be their best self under the circumstances. One thing we talk a lot about at Pickles Group is that um, everyone is grieving. People think a lot about grief as physical loss, like a death, and truly there are a lot of non-death losses that happen. So the second there's a cancer diagnosis, there's kind of the way things were before and the way things are now. And so we help our kids understand that there's a lot that has changed. There's a lot that I've lost. There's a lot that I can hold on to. But for the purposes of this slide, really thinking about the loss of the way things were before. Pickles Group was really started because these kids felt a loss of relatability. My friends don't understand it. My classmates don't get it. I want to meet other kids who get it. I want to be able to relate with other kids. And that's the whole point of Pickles Group, is them being able to be with other kids who say, like, yeah, I get that. I can talk about soccer and Minecraft, and I can talk about how my mom's in the hospital, and hold space for both of those things. The loss of childhood, sometimes these kids kind of have to grow up quicker than we want them to, and that can be really challenging. They might feel a loss of connection to others. There might be, kids will struggle with like my mom, has to we have to wear a mask now. I can't be around sickness. The winter can be hard. Loss of predictability, loss of plans. We see this a lot around different milestone times of year when maybe kids have a harder time, planning ahead. They don't really know, well, I don't really know how my parent is going to feel, or I don't really know how that meal is going to go for my parent. And so therefore there might be less planning, and kids often do well with plans. And so even just grieving the loss of plans and kind of knowing what to expect from day to day can be really challenging. Also, a lot of our kids might be facing what we would describe, and we'll be adding it to our new kid, is anticipatory grief. So, if, kind of knowing that someone will die, but not knowing when, that can happen for some of our kids. Many of our kids' parents get better. We talk about how most parents get better, some don't. We're here for all the ups and downs and sweet and sours. There's also ambiguous loss, which is where maybe a parent's abilities have changed. Maybe they're not able to play with me in the same way, and that can feel like a really heavy loss that kids in our program are facing. And trying to figure out and adjust to, how do I connect with my parent when the things that we used to love to do we can't do right now, or we can't do anymore. And being able to talk to another kid about that can be really helpful. So now I'm going to pivot to the getting ready for the what about the kids questions. So those original questions that we had on the slide, I'm kind of thinking about, how do you respond to those questions when you're getting them from parents? Before I do that, I want to talk about what we refer to as the Pickles Way. So this is something that we train our parents and our volunteers on. But the truth of the matter is that this can be applied to adults as well. So whether you're talking to a parent or a child, this is kind of how to handle when kids and adults need support over solutions. So we can't fix it, we can't make it better. What we can do is listen to what's on their mind, listen to what matters to them. And that's where we're really going to tap into, if we're meeting a patient for the first time, finding out that what really matters to them right now is, what about my kids? Okay, great. Here's a resource for that, right? Before we're throwing all this other stuff at them that they can't even process or digest. So listen to understand what they're thinking about, what they're worrying about. And like I said earlier, for kids, it might be really different than what an adult is thinking about. A kid might be just worried about, well, are you going to be at my soccer game? That might be the number one thing on their mind. And that might be really surprising to an adult who's thinking about all kinds of other things, but it's the most important thing to that child in that moment. And so then we can validate. That sounds really important. That makes sense to me. I hear that you're struggling with X, and really validate that whatever is on their mind, whatever they're thinking or feeling, does matter, and helping them feel seen and heard. Our volunteers are trained to take this approach, that they are not professionals. They are often students studying child life, nursing, or social work, so we can change the system and have more future professionals that know how to support parenting patients. But we really want them listening and validating these kids in our groups. Every time a kid says something, whether it's through the chat or off their mic, we want someone responding to them. Thank you for sharing. That sounds really important. And then building that community of kids supporting kids. Can anyone else talk about maybe when their parents been in the hospital and what you found helpful? Or does anyone else struggle with when your parents too tired to play with you? Let's talk about that, right? So giving kids the space to talk to each other. Reassurance doesn't necessarily mean fixing or a solution. It might mean problem solving. Like, it sounds like you're really missing playing catch with your dad. Let's see if we can find other ways to connect, or things like that. But it might be reassuring, like, I get that that's hard, and unfortunately that's not going to change for a while. So let's figure out how to get through it together. That's that coping piece. We might not be able to fix it. It might be, yeah, I get that that's hard. I'm so glad that you shared that with me. That's really important. Let's talk about that. Let's figure that out together, and give kids the tools and the space to really work through difficult things, even if there's not a clear answer or solution. So when a parent says, what about my kids? You might say something like, I'm sorry you're facing this. It's so hard and so important. So you see the validating. You know your children best, but what other patients have found helpful is. We get a lot of questions about, what about the parent that really doesn't want to tell their kids? And so this is kind of a line that can be helpful. Like, you know your kids best, you know your family best. And families have a lot of reasons why they're handling things a certain way. And what other patients have found helpful is this, and seeing if that's helpful to them. How am I going to tell my kids? I wish you didn't have to think about this. Parenting is hard enough. Would it be helpful if I gave you some resources on where to begin? Are you ready to think about what that might look like, right? So, really thinking about one step at a time, but first and foremost, validating, yeah, parenting is hard enough. I wish you didn't have to think about this. I can't let them see me upset. It's natural to be upset, and that takes so much courage. Again, we're not trying to fix that parent's feelings either. Like, it's okay to be upset. And we also want them to know it's okay to be upset with your child as well. I have to be strong for my kids. You might say, help me understand what being strong means. Or I think being strong is about being honest with your feelings. And this is a chance to teach your children how to feel and cope with really hard things. I don't want them to be scared. I shared this one earlier. Sometimes it's scarier for kids to not understand what is happening. And then we might lead into, what do you think they're seeing and understanding so far? What have you told them? Right. And I get into a lot more of that in the clinician how to in terms of applying some of these foundational skills to, okay, what do I say? What do I do? Or what do I have my parents say or do with their child? Maybe they won't need to know for a while. So this one wasn't on that first slide, but it's a question we get a lot. And so, one thing, I worry that they might learn about things from what they see and hear rather than their trusted adult. This comes up a lot with kids who can read. They might see the word cancer on a book or at the clinic. And so if they hear the word cancer or see the word cancer from someone other than you, what might that feel like, right? And again, often parents are more scared of those words than kids. And it's also perfectly okay to start with a problem with the cells. At Pickles Group, we do talk really openly. So when we enroll new families, we're always making sure that their kids have been told. And if they haven't, we're making sure parents have the resources to do so before their kid is joining a group of other kids who are aware of their parents' cancer. So we'll identify how and when to use external resources, and then I've got all the questions in the slide deck as well. So we'll have a little bit of time to talk as well. So obviously you all are, I saw in the chat, like at so many different centers, so different healthcare centers, different palliative care centers, different nonprofit organizations. So you may have resources that exist already within your team. It might be you. You might be the person that's getting called every time a parent asks, what about my kids? And so really understanding what's within your own resources and leaning on those teams and working together. We want to be able to add to those resources as much as possible, if whether they exist or don't exist. So obviously our support kit is really aiming to do that. We also have a list on our website of different organizations and resources and books that we recommend. We recognize that it can be really overwhelming to have too many options, and so we try to help parents kind of, understand what's available to them and then self-select what they need at any given time. And that's why we all work together. We're starting the Parenting Patients Champion program. We're part of the Alliance for Children of a Parent with Cancer, really trying to build that community of these types of supports so that parents have more access to what's available to them and can decide and determine what they need. And then self-care, I know I'm preaching to the choir, but I mean, I worked in the pediatric ICU for 10 years. I really strongly believe that like self-care requires self-compassion. And I think there's so much confusion around, self-care being like, I took a yoga class. It's so much more than that. It's really a way of life of saying like, I am just as important. I matter in this and being able to take care of ourselves so we can better take care of others. And that may mean trusting that you're where you're needed most at any given time. And so that may be with one patient or it may be with your own family at home, but really trusting that because you're pulled in so many different directions. I remember having, a 16-bed unit and I spent like hours in one room and that's where I was needed. But if I focused on the 15 beds I didn't get to, I would feel really bad. And I had to focus on, being where I was needed most. And the reason I bring this up is because if you're going to be the clinician that's really raising your hand and saying like I want to ask and who are the young people in my patients' lives. I want to identify parents. I want to make sure that they have what they need, to parent through cancer. You may be spending more time with those families. You may be in the room a little bit longer, and that can feel really stressful and pressuring when you're getting a lot of external pressure to do so much. And so trusting that you're where you're needed most and that might vary depending on the day or the week as well. So upcoming dates and deadlines. So I mentioned this at the beginning, but we do offer a Connect Over Cancer summer cohort. This is a time of year when many kids lose a lot of their supports. And so we want to make sure that the kids who need it have it. So our Connect Over Cancer program is our cornerstone social emotional 5-week virtual curriculum, and it is delivered by trained and skilled volunteers, mostly graduate students. Kids are in a closed cohort with their same aged or development peers, and it's available for first through 12th graders. So if you have any families in your mind right now, families that you saw today, last week, last month, or that are on your schedule, refer them today, and we will get them into the summer cohort. We have two forms. We have a referral form, which is something that you can fill out quickly with their permission. And then we have an enrollment form, which is a little bit longer. And so if you fill out the referral form, we'll take it from there. We'll call them, we'll email them, we'll text them, we'll get their kid in the right program to get settled for the summer. If they're ready to go and they want to enroll themselves, they can do that as well. Again, this is for our Connect Over Cancer summer cohort. And we are offering pickles jars in the fall, which is our monthly ongoing program. That's for kids who have done Connect Over Cancer and are looking for more ongoing support. That's for kids who have lost a parent to cancer. So we have bereavement specific jars. So that's open enrollment. If you have kids for that program, you can enroll them now. Our deadline will be like in September for that. So that's just why I just want to distinguish Connect Over Cancer deadline, June 27th. Pickles jars open enrollment right now. I mean, if you have any questions about the differences, we're happy to help with that. We also have a lot of webinars coming up. In July, we have our Centering the Experience of AAPI Families. We're going to talk about centering the experience of families in rural communities in August. And then in September, we're going to have a How to Talk to Kids About Rare Cancers. And then we also, the more kids we serve, the more volunteers we need. So if you're on the call and you work with students or you are a student or you want to get more involved, our deadline for volunteering with the youth is tomorrow. So we do interviews and training and background checks. So it's a process. So we want to get you in if you're interested in volunteering. I'm just looking at the chat. So my colleague Miriam is sharing a bunch of our resources. So please open those and share those. And then I see there's a question about in-person events. So we do have a handful of in-person events here in the Chicagoland area. We offer about 4 a year. Those are community-based events. We've also offered some in Ohio. We have really found that we are a digital first organization. So our virtual format is where we're seeing the most growth and impact. And so if we ever have enough kids in a concentrated area, we are open to in-person events and we'll continue to prioritize that. But virtual is really where we see the most traction, and we need a good group of kids to be able to really have a meaningful experience. So right now, mostly virtual, but they're national. People can join from anywhere. Okay, I'm gonna jump forward to, so these are just some of the things people are saying, but I want to make sure I get to your questions. So for the developmental appropriate time frame document, yeah, so I think our family cancer support kit really addresses some of this in terms of different age ranges and common questions, but the clinician how-to also might be helpful. In terms of the biggest need and concern identified by parents with cancer, I think it's often the questions you saw today, like what about my kids? How do I tell them? What do I say? Are they going to be okay? The Will You Speak About Doing Legacy Making, that's actually in the How to Prepare the Kids. So that's our second clinician webinar, which is available on our YouTube channel or as a tailored webinar through our Parenting Patients Champion program. And I talk a lot more about end of life support, including legacy making. One of our partners, Inheritance of Hope, has a free legacy video service, so that could be something that could be really helpful. Definitely for academic concerns, this is not something we necessarily do at Pickles Group, but professionally, I can speak to helping have open communication with school. I do encourage parents informing the school and involving kids in that, especially teenagers, so it's not, behind their back. They know that that's happening. Identifying, who is a homeroom teacher or a favorite teacher or a social worker who can kind of know what's going on and help advocate. Sometimes kids can have adjusted timelines and workloads and things like that to help with their academic uh, success during this difficult time. For ideas for preparing and supporting families for bone marrow transplant. Yeah. So that could be something that we could even build content around. But certainly if, a kid is separated from their parent for a long time, we're thinking about how to stay connected and stay involved and giving kids more kind of choice and empowerment in that. For some kids, it can be really distressing or upsetting to like FaceTime a lot, and for other kids, it can be really helpful. So kind of following their lead and figuring out what is most helpful, and them really understanding the why of why their parent is perhaps admitted for a long period of time, and giving them some tools to stay involved and stay connected. With young kids, I've done like mailboxes and things like that. I've even had kids who are parents who are on, sensitive treatments that require them to be separated even like within the home. And so having like a mailbox outside the room or a notebook that they share back and forth, or things like that. But every kid's a little bit different in terms of what they need or can handle. Um, Great question. Opportunities for child life students to volunteer with Pickles Group. Yes, we partner with a lot of universities. So Daniela, our director of strategic partners, is a great person to ask to connect with about this. We actually have some schools around the country where the whole class is actually going through our program and volunteering to be a facilitator for our cohort of kids. So the training they receive is pretty extensive. We do interviews. We have a live training. We have asynchronous training. We have a pre-brief for each program, and then we also have an ongoing debrief process. We also have unique opportunities for students to get more involved. We have a family recruitment call center, among other. I just at the Child Life Professional Conference, we brought 3 students with us to help support the booth and also attend the conference for on our behalf. And so there's a lot of opportunities for students. And when we can partner with the university, it helps both of us because then we can have more qualified volunteers, but then your students get that professional development as well. Just double checking the chat here. Thank you, Miriam, for sharing the volunteer opportunity link. Um, yeah, so I'm seeing, so for support groups, um, yeah, I mean, we have I designed our curriculum and it's really child life informed. It's activity based. And so we use an arc where kids are playing games and having, specific traditions and things that they can expect each week or each month that are predictable. And some of the goals are just building relationships, getting to know each other. And sometimes there's a deeper meaning around, learning about cancer or processing feelings. So kids are play-based. They really need hands-on interaction. And so sometimes it's a little bit lighthearted and sometimes it's a little bit more in depth. And we really follow their lead. We have some groups that go deeper than others, but we always talk about planting seeds. And even if there's not these like aha transformative moments, there's a lot of impact and value that kids get out of the program. And so we just follow their lead. We don't force anyone to participate before they're ready, but they participate in their own way, and that works for them. In terms of patients with who have special needs children, yeah, so there are some resources available. We have one book listed on our website that's specifically to talk to kids about cancer who have autism. That is a great book. And then within our program, we do have a lot of children who go through our program who are neurodivergent. We just want the child's academic or functioning level to be within that first to 12th grade level so they can engage with the material. But we just adjust the age group in which a child is in. So if we have a kid who maybe is in 7th grade, but they're maybe more at like a 4th grade level, we'd put them with a younger group of kids. We've also extended our inclusion criteria to match disability inclusion academic services. So we've had some kids in that like 18 to 22 range, and we just adjust the group they're in, and we have a couple other processes in place from a safety and inclusion perspective. And then in terms of limited areas with limited counseling. So we have a list of a lot of resources on our website. We we do recommend Wonders and Worries a lot. They provide professional support, including their free helpline, as well as they have child life services throughout the country from their registered Wonders and Worries provider program. So that could be a valuable resource because it may not be always a traditional counseling need. It may be that child life need where it's helping kids understand their parents' cancer and process their feelings and build coping skills. But of course, if it's more of a true mental health concern, then it would be best to get resources from like a pediatrician or a school social worker or something to get that local mental health support. We also looked at cancer support community a lot, finding a support center near you that can be helpful depending on what area. But again, to this question, I'm guessing this might be getting at some of the rural communities, and hopefully we'll be covering some of that in our rural communities webinar later this year, just given access in outside areas from larger cities that maybe have more resources going on. Okay, so I wanted to just address that next steps, so any questions you have, you can email us at contact@picklesgroup.org. And even if it needs to get rerouted to me or to Daniela or someone else, we'll make sure that it gets to the right place. Our website is picklesgroup.org. You can follow us on social media. And then most importantly, if you're not already, request our support kits. You can give them out to your patients and families. And please, please, please refer a family to help get them in for our summer cohort. That is extremely important. We cannot do this work without you. And you know which families need it, and then we can take it from there. So please refer. And yeah, we have some time for questions, and I'll have I know Miriam is putting lots of links in the chat, so feel free to copy and paste those or open those and save them. If you are interested in becoming a parenting patients champion and you're not already, Daniela is a great person to connect with that. So I'll have Miriam put information about the Parenting Patients Champion program in there as well. Thank you so much. We have like 5 minutes. So I'm committed to staying on if there's any questions. And then the recording will also be shared with anyone who is not able to be here live. Thank you so much.